Hello viewers, welcome back to my channel. Today we will talk about Barber Surgeons and Bolam test. Barbers are barbers, surgeons are surgeons. What are Barber Surgeons? So today barbers perform a particular task and surgeons perform a different task, but in the 15th century, barbers and surgeons were one and the same thing. Doctors of that era considered surgery as a task beneath their dignity. They looked down upon surgery, so surgery was performed by barbers who had excellent dexterity. Slowly, barbers started moving away from the world of surgery, and surgeons cannot cut their hair even if their life depended on it. So barbers separated from surgeons, and today we have two separate professions. However, the origin of surgery starts from barber shops, and even today there are some barber shops which have the red and white pole outside them, denoting at one point in time they did indulge in activities which involved blood loss, that is the red, and white denoting the white dressing, gauze, bandage, etc. Interesting, isn't it? There are 4 Royal Colleges of Surgeons, and in chronological order the oldest one is in Ireland, in Dublin, Royal College of Surgeons of Ireland. Second in line is the Royal College of Surgeons of Edinburgh in Scotland. Third is the Royal College of Physicians and Surgeons of Glasgow, and the youngest, the most recent Royal College of Surgeons is the one in London, Royal College of Surgeons of England, which was established in 1800, only about 200 odd years back. So quite young, isn't it? Having said that, let's move on to Bolam test. What is Bolam test? So with Bolam test, I'm going to conclude the topic of legal and management issues in surgery. This is the one issue or the one topic that is unique for MRCS. The other topics are universally read all over the world, but the legal and management issues in surgery cater to specifically the scenario in the United Kingdom. So in the previous video, last Thursday, I talked about Gillick competence and I talked about the 4 consent forms used in the NHS. Today we will talk about Bolam test, and this will conclude the topic of legal and management issues in surgery. Bolam test is a test of assessing medical negligence. So in order to prove medical negligence, you have to prove 3 Ds. Number 1 D is duty. There has to be a duty between a doctor and a patient, which always is there. The second D is dereliction of duty. The duty that existed between the doctor and a patient, there was dereliction of that. And the third D is damage caused due to dereliction of duty. So a doctor failed to perform duty, and this led to damage to a patient. If all 3 are proven, then the doctor is proven to have committed medical negligence. Now the test to prove this is Bolam test. What is Bolam test? Bolam test basically assesses that the duty that existed was performed or not, and this is determined by a responsible body for that profession. So say a surgeon, whether a surgeon has performed the task or not, there has to be a body of surgeons who will determine that the actions of the surgeon were in contravention of the standard of care or not. Did the surgeon perform as every surgeon is supposed to perform in that situation? Did he perform in the standardized manner or not? This is Bolam test. If the surgeon passes Bolam test, then he did not commit medical negligence. If he fails it, then he has committed medical negligence. So Bolam test decides whether the care provided by a doctor is in line with the standard of care in that situation or not. If any other doctor would be in the same situation, would they have done the same thing or not? So this is Bolam test, and I hope you like this video. Take care, best of luck for MRCS Part A. Tune in next Thursday, I'll come up with a new video regarding how to prepare for MRCS Part A. Take care, bye bye, and don't forget to be awesome.